Welcome back to Understanding Human Anatomy and continuation of our discussion of the perineum. Now, in an earlier video, I mentioned that the perineum can be divided into two triangles. The perineum, of course, is a diamond shape, so if we drew a line across the ischial tuberosities, like so, and you can see that it comes close and actually does go through the perineal body. We can divide the perineum into two triangles, an anterior triangle, which is the urogenital triangle, and let me draw a line into there. And a posterior triangle, which is the anal triangle. And we have one additional muscle to add to the anal triangle, and that muscle is the external anal sphincter. The external anal sphincter takes origin from the fascia around the anus, and wraps around the anus so it will function as a constrictor on the opening of the anus. Now, if you read in a comprehensive anatomy text like Gray's Anatomy, you'll find it's actually a very complicated muscle with several parts to it. We're not going to delve into the various subdivisions of this muscle, but this is the external anal sphincter. And like most sphincter muscles, it is donut shaped, so that when its fibers contract, they constrict the opening of the anus. This is the primary muscle used for voluntary control of defecation, the external anal sphincter. The rest of the area you see in here between the external anal sphincter and the sacrotuberous ligament is filled with fat and actually forms an area known as the ischiorectal fossa. And what I'd like to do is now draw a section, a coronal section, that will be drawn right through the rectum and anus, cutting the rectum and anus in a longitudinal direction. That will be in the next slide. And let me start like I do most of these drawings with drawing in some bony landmarks. And we'll start with the os cocci. And we have the expanded iliac wings. You notice these bones are relatively thin, relatively flat. And we have the expanded iliac wings, and the expanded iliac wings are sometimes referred to as the false pelvis. And we have what would be ilium and ischium down here lower, forming the true pelvis. And then I want to sketch in the terminal portion of the digestive tract. And what we'll do is start with a little bit of sigmoid colon coming down into the rectum and anus. Like so. And next we're going to need some muscle, and what we're going to find is that there's a flat muscle taking origin from the expanded iliac wings. And this muscle is iliacus. I've sketched in here. There. We also have a muscle taking origin from the inner surface of the true pelvis in the lower half down here. And that would be right here. And this is the Obturator Internus muscle. There. And I want to draw a layer of fascia over the surface of each of these muscles. So iliacus fascia, and then obturator internus fascia. Another muscle we need to draw in right here, and this is the psoas muscle. And again, there'll be fascia wrapping around the psoas muscle. Now we've got that drawn in, I want to also draw in the peritoneum, the visceral peritoneum on the sigmoid colon, and then indicate that there is a mesentery associated with the sigmoid colon. Now, another muscle that we're going to sketch in is the Levator Ani. And you see that it is taking origin, at least in part, off of the Obturator Internus fascia. And the other muscle we want to draw in is the external anal sphincter, which we'll draw in right here. So, we have Levator Ani, the psoas major, and the external anal sphincter. Now, what we're going to find is that there is fascia over Levator Ani, and it continues down onto the external anal sphincter. This fascia will originate from the Obturator Internus fascia, and it will wrap around Levator Ani like so, and then continue down and wrap around the external anal sphincter. So it starts here at the Obturator Internus, comes down, wraps up Levator Ani, and then the fascia continues inferiorly and wraps around the external anal sphincter, like so. Now, the fascia are named the internal fascia of the pelvic diaphragm, and the external fascia of the pelvic diaphragm. And we'll draw a line to it. And the rest of the space in here is the ischiorectal fossa. And the ischiorectal fossa is primarily filled with fat, except for a small compartment. It's a small fascial compartment. I use a different color for this fascia. And of course it's bilateral, so I have to draw it in on both sides. And this is the Pudendal Canal. And the Pudendal Canal contains an artery, a vein, and a nerve. So, this is the Pudendal Canal. And the Pudendal Canal contains the internal pudendal artery, the internal pudendal vein, and the pudendal nerve running in this canal. So we'll connect the lines to the labels. Again, internal pudendal artery, internal pudendal vein, and the pudendal nerve. And among other things, the artery, vein, and nerve will be sending branches to the external anal sphincter. So I'll draw in a few branches here of each one. Like so. And these branches just run through the ischiorectal fossa. The remainder of the ischiorectal fossa is just filled with fat. So, in the anal triangle, we have the external anal sphincter. We have the pudendal canal with the internal pudendal artery, internal pudendal vein, and pudendal nerve. We have the fascia that surrounds levator ani, the internal fascia of the pelvic diaphragm, and the external fascia of the pelvic diaphragm. And in between all these, this space is the ischiorectal fossa, and the ischiorectal fossa is just filled with fat. That concludes our discussion of the anal triangle. When we resume, we'll start talking about the urogenital triangle. Thank you for your attention.